experts who I'm very excited to hear what they're going to say and what they're going to tell us about youth well-being and mental health. And basically, we're having this session because we want to interrogate our public health system in Africa, our readiness and response towards issues affecting us young people in youth. How do we feel we reacted as an African nation, looking at all issues that affect us, mental health, and just general wellness in general. I am going to introduce our panelists, which, like I said, are very esteemed individual. And I'm really excited to hear what they're going to be talking about today, or what we're going to be talking about today. And the first one is Alistair Mukondiwa. Alistair is the Regional Director for Africa at the International Federation of Medical Students, IFMSA. And then we have Haja Tena, who is a young Algerian activist, is also certified career advisor, soft skills coach, and a teacher of English. Haja works for the youth capacity development in her region. And we also have Belinda Nyapi, who is a mental health activist, founder and director of Marcus Momezi Foundation in Tanzania, and holds a bachelor's degree in information and technology and certification in HIV, sexual and health promotion outreach, and early child development. We also have Nicolette Buliani, who's the vice president of Botswana Youth Model United Nations and founder of Walking the African Journey, a youth empowerment organization with a footprint in Lesotho, Swaziland, South Africa, Zimbabwe, and Malawi.
All right, thank you. I had already been introduced. So my name is Alistair. I work for the International Federation for Medical Students Association, IFMSA, which is a board that includes medical students from all over the world. Currently, we're in 129 countries with 140 national member organizations. And I'm currently working as the regional director for Africa. And basically, our work is with medical students interested in global health, and also with other healthcare professionals allied to us. So that's basically me. And she had already introduced me, so there's not much to say.
Sorry about that. I think something happened to my network, but I am back. I am really, really sorry about that. I was at Senelisiwe, and because of time, would really like to introduce everybody quickly, just so that we could get onto the amazing conversations we're about to have. So we had said Senelisiwe is a counselor and a vocal mental health activist from the Kingdom of Eswatini, and she served at an international mental health resource for 3 years as a volunteer counselor and public relations officer. And last but not least, we have Gogodineo Ndlasi, who is a preeminent and pioneer who has successfully matched the sacredness and spirituality of Ubungoma with modern thinking. She's also a celebrated spiritual teacher, life coach, African storyteller, writer, dancer, trained facilitator, and soon-to-be health and wellness instructor. So as you can tell, we've got an amazing panel, and we are really excited to start our conversations. And just to start our conversation, Alistair, as a medical student and working with young people in that space, what are some of the key emerging public health issues preventing young people from enjoying health that are highlighted during the COVID-19 pandemic?
I think the biggest issue, like one thing that we really believe in as medical students, is that there's no health without mental health. So in this period, it has been a very uncertain period for everyone. Most importantly, the young people and the young people in the healthcare fraternity or the healthcare sector, because the COVID-19 is something that is directly affecting our health sectors, our health systems, which have been perennially suffering a lot of backlog and issues, have been impinged upon by this pandemic. And this has just really shaken a few things up for us. So we're very anxious. There's a lot of anxiety because school has been stopped, and also, the actual risk of COVID-19 is real and present in our daily lives. And this is something that has really unsettled a lot of people, but there's a lot of work being done. And I think currently there's really a big issue with the mental health and the anxiety and the depression that has already been in our systems. And that's really affecting young people a lot, particularly those in healthcare and those who are medical students. So I think that's one of the biggest issues that we're having right now. Yeah.
Okay. And Dr. Charles Humer, as a doctor who's been working for a while, what can you say to add on to what Alistair just said in terms of some of the emerging public health issues that are preventing young people from getting health or full health?
Okay. Hello, everyone. Well, over time, the COVID-19 epidemic have affected the way that young people assess things. First, from interfering with their businesses to their work. Most of them now sit at home, and their education also have been interfered over time. So young people in most parts of Africa and in the world are generally suffering from mental stress and some economic disturbances due to the effect of the COVID-19 epidemic, especially the lockdown. Even some have been fired from work. So I think that young people need to be empowered on alternative ways of living, especially in terms of work, entrepreneurship, and other aspects of their life.
Thank you, Dr. Ume. I think what's coming across now is we can see that this COVID-19 pandemic has really, really stressed us in terms of mental health and other issues. But Dr. Ume, we've heard our existing public health systems or structures which we already have, and we are all aware that our systems are not the strongest, or we have what we can term a really overburdened public health system. What do you think about our infrastructures? What do you think it has taught us? At the beginning of the pandemic, we had a lot of people actually make fun and joke to say, right now our African leaders now have to face the African health system and don't have to go outside to get help. What is your view on that? What did COVID teach us about our infrastructure?
Okay, over time, due to the pandemic, a lot of changes have been made in the way that people access healthcare services. Some countries have adopted mobile clinics and healthcare service at people's doorstep in order to improve their ability to basic healthcare facilities. And also, there have been increased funding of projects and initiatives which are geared towards increasing accessibility of healthcare services among people living in remote areas, rural areas, elderly people, and other vulnerables.
Okay, thank you so much, Dr. Ume. Good to know. It's quite interesting that every time we talk about our infrastructures, we think of just the building itself, but sometimes it extends to actually the people who are in that building. And as a pioneer in Sangoma, what do you think this has shown us now? Do we really need to have that integrated systems where we have both our traditional leaders as well as our modern leaders, modern medical leaders, being in the same place to provide comprehensive care?
So I think maybe you meant traditional healers, because leaders are. But I think I wanted to speak about, we can sit and contemplate on how this is challenging, or we can see it as an opportunity for us as a continent. because I think that COVID came at a time where we were quite complacent as a continent to find our own solutions to our own systemic problems. Because when we look at COVID, the reason that is having an impact on our mental wellness, it shows that actually the human system is complex and everything is interconnected. Because what happens when COVID came in, we understood that it's a biomedical thing, but it affected the psyche and the psychology. And it also was an invitation for us to also start looking at our spiritual identity and our spiritual well-being. And as a continent, when we look at indigenous ways of healing and indigenous ways of practicing, when we come across a disease, we say, what is not at ease with the system? Hence, we are manifesting what we are manifesting. So the manifestation of COVID-19 clearly says to us as the global community, but also as Africans, to say things as they've used to be done are not working because they've only served a minority. You know, health systems as they've been structured, because they've also been structured with very Western constructs that have not applied for the majority of the people seeking health services in the continent. So this is really an invitation for us to interrogate. And it's not to say, let's go back to 1856, but is there something in 1856 in how we healed the human body, we healed the human mind and the human spirit that offered wellness, not only health, because wellness, well-being it's a holistic approach to healing the human system. Because this is asking us to, we are in lockdown. It says, let's look within, let's pause, because we're going through some sort of initiation or rebirthing process. And it is an opportunity for us as a continent to come together as a collective in a way that we have not come before. It's an opportunity for us to say, what is it that we have that is within our resources that can address this issue at a biomedical level? So what are some of the things that we have that we know of as a continent that we can start to test and run with it? And what are the things that we have as resources that can support people also psychologically and emotionally to deal with the pandemic? So as a spiritual healer, I always see challenges as an invitation for us to do things anew. I see them as an opportunity to rebirth, because it says the system that we have, the health system as we have it right now, has not served us as a continent. It has not served us as a country. It has not served us as individuals, because we do understand that people who have access to high healthcare qualities, people who have also resources to access those things, but majority of the people don't have the financial resources to get private healthcare, where you can deal with your symptoms of COVID and then see a psychologist at the same time. So what is this inviting us to move towards as a continent? What is this inviting us to start changing?
Thank you so much, Gogodino. I really love how you're now saying this is not actually a challenge, but a time for us to integrate our systems. Let us sit now and interrogate how a lot of services being disrupted. And basically to everybody who's here, we're now looking at all services that are there, key populations, SRH services, as well as HIV services. They've been disrupted. How could we have made sure that these services are not neglected? Or do we really think they were neglected, or we think everything was appropriately done during this time? How could we have intensified and made sure that they're not neglected? Dr. Charles Ume?
Okay. Well, due to the COVID-19 epidemic, some part of the healthcare sector have actually been neglected over time. But as the epidemic progressed, there have been policies and discussions on how to make sure that other parts of public health, especially when it comes to HIV care and malaria and treatment of other chronic epidemics, that they will not be neglected. So, like I said earlier, there have been some channeling of funding by government institutions, foundations, to support initiatives and integrate those other aspects of comprehensive healthcare treatment into the health system and intensify other aspects of healthcare treatments. So I actually think that even though there have been some degree of neglect in providing those other care, well, I feel that due to the increased funding that's being pushed into those sectors, that those other aspects of of healthcare and public health will be given much more attention as time go on.
Okay, and so Nalisiwe, as a mental health activist, what do you think? Do you think the issues of mental health were adequately addressed during this time, or you think we could have done more? Do you consider it as some of the medical issues that were neglected during COVID-19?
Hi guys. So I actually think that our governments have literally done nothing when it comes to mental health, because I feel like they focused more on like the physical and COVID-19 during this time. They totally forgot about mental health. You find out that, for example, when it comes to the patients who are cured of COVID-19, I think more than anything, they need to be taken care of mentally. But if that is actually not happening in our societies, and you find out that after being discharged from hospitals, when they go back to their communities, the people in their communities, they actually see COVID-19 written on their faces. They actually discriminate them in such a way that they feel so horrible that they contracted the disease. And there's literally nothing much being done on mental health, which is very, very disappointing. And I feel like this pandemic has actually affected everyone psychologically, because we cannot ignore the fact that a lot of people have lost their jobs, a lot of people are at home, more especially young people are back at home living with families. And we all know how African families can be sometimes, which is really difficult for young people to be at home and kind of take it all in. So I actually feel like we need more of mental health awareness. We need more of mental health services. We need a lot on mental health care than because their focus mainly is on physical health and trying to treat the virus. So I think we really do need mental health care interventions, one way or the other.
That's very true, Sanelisiwe. Alistair, what do you think of us? Did we really do well in terms of still taking care of other health emergencies, or do you feel like we neglected them, looking from a medical perspective?
I think if we're going to double down and just be very frank, our health systems have already been taking a lot of battering from a lot of non-communicable diseases, communicable diseases. The healthcare workforce has already been having a lot of issues, undercompensation, unhealthy working environments and whatnot. And the additional burden of something like COVID-19 has a profound effect even at the hospital level, because the beds are taken by the patients, the ICU beds are going to be taken also. So it is bound to be an issue that there would be less attention to other medical emergencies. But I believe that it's rather a systemic error rather than an actual issue that's intentional, because there are issues rather than something that is intentional, because there's a lot of attention and funding that is being placed on COVID-19. And I think the transformation that needs to be done across the region specifically is that there should be a lot of task shifting that is taking place, a lot of prioritizing of strengthening the primary healthcare centers. There should be an integrated system that offers an inclusive range of services, including that of mental health care. Things such as telemedicine should be prioritized. There should be an inclusion of telemedicine, but also that brings into account some realities that we face within the region, because there's a digital divide. Because not everybody has access to the internet. Not everybody has an access to a Zoom call. So that severely hampers any improvement that we may make to telemedicine or e-medicine. So a lot has been done. I'm sure people are not neglecting it, but from a decision-making point of view, a lot of intentional policies should be taken to ensure that there's a strengthening of the primary healthcare systems, of the public healthcare system, so that they may be able to cater for everyone. So yeah, that's what I think.
I really love that how you looked at it from an opportunity point of view rather than a neglect. Like this time has really shown us that we have to intensify or strengthen our public health system so that should anything like this happen, then we are more than ready to actually now face it without any more issues. So thank you for highlighting that. And Belinda, many countries have been on lockdown or extreme social distancing, which has really been uncomfortable for many of us. We had a quick chat at the beginning of this, which brought consequences on our young people's well-being and mental health. What issues did you see coming across during this time? Like, were there any highlighted issues in terms of mental health issues that were really highlighted? Belinda?
Thank you. Hi, everyone. Yes, we have seen a lot of numbers. Us personally, Marcus Mamezi Foundation, we deal with connecting people who need mental health services. But since this pandemic started, we have seen a large number of people needing our support. And that goes to show that a lot of people had panicked in the beginning and had anxiety, especially young people, because, well, their normal routine has been disrupted. So because of that, well, we have seen a lot of cases of anxiety and mild depression coming up.
Oh, okay, Belinda. Mild depression and other issues. Gogodinao, what would you say as a spiritual healer during this time or during lockdown? Do you feel you still had people reach out to you with mental issues or with just spiritual issues that they were going through, or the lockdown hampered that from happening?
I think firstly, it's okay for us to sit and wait for the government and not take initiative. I said earlier on, this is an opportunity where we can also step up and create initiatives that can support us as a community, because everyone has been impacted financially, emotionally, and mentally. And how can we create, how can we create, because we need to also understand that before mental illness become a clinical, it becomes situational. So people are experiencing difficulty in the current situation that we're in. So there's things that we can do, even with the panelists that and the people who have joined this webinar, to say, what do I have capacity to do and capacity to offer? So I've used social media as a tool of offering support. So I run online healing conversations, because this is also an invitation for us to heal. We understand that some of the causes of mental illness is because we've got pains that we're not dealing with, we've got hurts that we have not processed, because when business was as usual, we were consumed by a lot of things. We were consumed by shopping, we were consumed by work, we were consumed by activities. So now we are being confronted with looking with ourselves, because it's now you and yourself, and you need to be facing those demons that you've been running away from. So how can we use our own resources, and how can we use our own experiences and expertise to support each other? So how do we? So I've had a lot of people still reaching out, and sometimes you also have to amend your ways of doing things. So there's a lot of people who offer spiritual support, but they might want us to come to a gathering, they might want us to come to a building. But that's why there's technology. We're moving into the fifth industrial revolution. We need all start to accustom ourselves to these technological tools that we that are not really friendly. And I do understand that not everybody has access to them, because we live in different environments and we come from different communities. But with what you have, so Sanelisiwe, with what you have, can you run, can we have a community groups that come together, even if it's 4 people that you can, your neighbors, just check-ins, how are you doing? How, can you just say, are we coming together to instill the spirit of Ubuntu? Because people who are lacking because they've lost their jobs and there's pressures, what are we doing as the community to support each other? How are we sharing? How are we caring as a community? Because I feel like I said earlier on, this is an
I think we've lost Gogodi now. Therefore, okay, she's back.
If we want to, yes, if I'm saying that if we want to continue resolving our challenges or our health issues with the same mindset that have created diseases, we are not going to really come out of this with gifts and with opportunities of changing. So it's an invitation. I think my other thing I'm saying to young people, what is really deeply suppressing you right now? What are you feeling depressed about? Are you feeling depressed about that you can't put food on the table? Or are you feeling depressed that certain things that you have taken you away from yourself are now taken out? So you can't go to the shops, for example, you can't go out for coffee, because that can lead somebody to. So let's look at some of the situational issues that can lead to clinical mental healthcare issues, and say, how do we become proactive, and how do we start engaging within the resources, within the communities, as the panel that are sitting here? What is it that we can start to do in support and create systems that can work for our people? Because we cannot wait for the government to always change the systems. We are also the people who've put the government in place. So let's go and say, this is what we certain things or certain experiences or certain models, and it's an
Gogodino keeps on disappearing. Belinda, in relation to this question that we're currently having, I've had a question come that says, how can we best deal with mental health issues in children who've been out of school for a while? And I think this is an important, and I think everybody needs to get the answer right now as we're going through the conversation. So Belinda, how can we best deal with mental health issues in children? And what signs should we really look for?
All right. First of all, mental health is an issue that we don't normally talk about openly. So it makes it even harder now to talk about it, but we must. So because we're dealing with children, even younger youth, it's really hard to get them to understand what it is. But I think we should find a way where, like, we could use something that they could relate to, cartoons or things that I'm sure, that is very visual, that a child can see and understand, because it's already, feelings don't really tell you that you're young, you can't have these feelings, or you're old, you can't have these feelings. We all get the same feelings, we all get anxieties, and it's worse for kids because we don't even talk to them like that. Being African, I don't know, I'm talking about Tanzania right now. So I think we need to find a way where we can have things to engage children in this topic, because it's something that is affecting them also. So look for ways that maybe have cartoonists that can come up with a short skit or something that could help children to explore their feelings and talk about how they feel with all the changes that they've experienced in this couple of months.
Thank you, Belinda. And it's quite interesting that we've seen a lot of those coming now, and people actually sharing them around. The second part of the question was, what signs can we be looking for in children and adults during this time to show that there are any mental health issues that are emerging?
I think most signs are like, sitting by yourself, neglecting things that you would normally do, lose interest in, especially in young children, and agitation also, because you get a lot of kids that have outbursts and they don't even know what is causing them, because they just have feelings that they don't really understand them themselves. So I think those are a few things that we need to look out for.
Yeah, okay. And Nicolette, as a media specialist, or somebody who's really worked in the spaces of media, what challenges do we see in adequately addressing mental health issues? What strategies do you think we could have brought to the ground to try and address the issues of mental health issues? Any innovative ways that we might have missed on our way or not?
So firstly, I think there was an over obsession of the COVID coverage, and that led to people being scared. I think we did a survey with our youth in Southern Africa, and we saw that with media coverage within the first phase, when the lockdown started, there was generally fear and anxiety because of the amount of deaths that were reported, the way the numbers of death and infections were just going on and on. So I think in terms of strategy, what we could have done was also report on the statistics, yes, but also look at ways in which would help people to cope, being in lockdown and prevention. I know we did that, but then I think there should have been a bit more emotion there on how we can, steps in which people can take, to manage the situation, the stress, the anxiety, and especially for people with mental health. So I think on that we should have done better instead of over obsessing over the ills and the disadvantages and stuff. Yeah.
Yes, and Haja, as a soft skills coach, what do you think we could have done better? Like, I feel like Belinda is onto something. It was more of a shock than anything to the system. What do you think we could have done differently in terms of being innovative about addressing issues of mental health issues? Haja?
Yeah. Thank you so much for the invitation. To start with, as C.S. Lewis said, and I quote, "We cannot go back and change the beginning, but we can start where we are and to change the ending." And as an educationist, most of my work and the soft skills coach, I work with youth in my region. I believe that it is the first time for many of us to face such and to face and to witness such a global pandemic. Our first experience to follow such an universal, mandatory, restricted daily rules and routines. And as I believe that modern crises, modern problems require modern solutions. As a soft skills, we believe that we have to work more on their mental health. How is that? Launching virtual campaigns like the one that we are gathered here today, work with them online, uh, maintain workshops to help them. How? That these youth, we give them a space, an online space where they can share their concerns and share their worries, because before they used to have leisure places where they go there and share a lot in public with others. Now everything is locked, everything is closed. They feel like more stress. Their stress is higher. So now we have to work all together to and try to work on outlining solutions for the youth. For instance, like in my country, the government, they launched a phone line. It's for free, that people, they can phone and they can meet therapists and psychologists, that they can help them going through this situation.
Okay. Thank you so much, Haja. The same concept keeps on coming forward. We're in a modern world. Let's have modern solutions to our problems and not just think we can still apply the same old techniques and get the same answers. So, Neliswe, do you think we're innovative enough as a mental health activists? Did we do enough in terms of addressing issues?
I personally feel like we are innovative, but we are not doing much. I mean to say that we have all the means of doing a lot of things online, stuff, but I feel like it's a really difficult time for every one of us, and we are all going through so much. so much that we are taking care of ourselves more than we are trying to take care of others. But I personally feel like, yes, we are innovative enough. There's a lot of things that we can do. We can work on our social media campaigns and try and educate people and maybe try and avail ourselves to people who need help and kind of try and find a way in which we can work around helping young people online because we can't obviously meet them. So I think that if we try, we can do a lot.
Okay, so Alicia, your volume is a bit low, and there's a question for you. How can mental health specialists help beyond the physical consultations?
I think we can possibly try and work online and to launch phones where we can like try and communicate with people without having to meet them physically. So I think we can make use of social media, make use of our phones, make use of all these other platforms. Because right now we are here on this platform, we can have like some sort of groups where we can try and talk to people, have group therapy sessions online, and do all of these things online, which is something that we can possibly do um, in our various countries.
Okay, thank you so much, Janelle. We're about to really come to wrapping up our session. And Gogodino, there's a beautiful question that I would want you to answer after this so that everybody can really get an answer to it as well. But before we get to it, what advice can you give to young people to take care of their health? That is the overall well-being during this time. And I think every panelist can actually just have a go at this question and just try to give us an answer to how can we really make sure that young people take care of their health. We can start with you, Nicolette.
So my advice is that we have a tendency to look on the physical health only. So let's focus on our mental health as well. Let's not, I think for my youth in Africa, especially within this pandemic, let's not put ourselves pressure on what our socio-economic status is now and what it will be after COVID, but let's take this time to just revamp ourselves, rethink what we want to do, and just enjoy this. I would call it just a holiday away from the normal holidays, and just rethink what we want to do, research and start learning new things, so that you just get your mind off things. Take care of your mental the same way.
Okay, Haja, how can you? What advice would you give to young people in terms of that overall well-being?
Well, I think it's as my colleague said previously, that we should not take this situation as like it's the end of the world. No, let's think of it as it's a break was given to us from God, from heaven, that we have to revise our selections, whether in terms of our education selections, academic, daily life selections, and try to work on them, fix those who are needed to be fixed, try to improve those things that we have and capacities that we have in us, try to develop ourselves. To sum up, it is a time to discover ourselves, to discover what we can give to our countries, to our motherland, Africa, because I believe it is the time to reconnect, to reconnect all the African youth, because we have to bear in mind that we are the youngest continent. We have with an average of 19.7% the medium of age. So we have potentials, and this is the high time to reconnect again, to put our hands together towards a better and a good tomorrow. Why not? We can give this the cure of this pandemic or whatever crisis we may face in the future, because our motherland has faced and witnessed a lot of crises, and we have the immunity to go forward. We can give. So this is my advice: is that we connect together and we can give and work on ourselves to be more productive, inshallah.
Okay, thank you so much, Haja. Dr. Charles, what advice would you give to young people?
Okay, the advice I want to give to young people is that they should, as they're staying at home, they should learn new skills. They should try and adapt to the current situation. They should know that the pandemic will not last forever. Young people should try and connect together, learn new things. Then they should also have someone to talk to. Maybe online, they can find online social groups, online psychological counseling groups in case the person has any form of mental challenges. So in summary, young people should try and adapt to this pandemic that we have found ourselves. They should know that this is not going to last forever, that we shall come out from it one day.
Okay. Sana Lisiwe, any advice to young people about their health?
I think the most important part is that we should shift the narratives away from like the number of deaths when it comes to this pandemic, and we have to like try and keep our daily routines as much as possible, and we should have like Dr. Charles said, we should have people that we can talk to without being judged. And I think the most important part that we should take this time as a retreat where we kind of have this time to ourselves to kind of reboot, to kind of change our perspectives, kind of improve ourselves. And I think that way we will be okay.
Okay. Alistair, thank you so much, Sanlisiwe.
Maybe I can sum it up by saying that it's an important time to switch off and switch up. Switch off meaning that when we get all facts about what's happening in the world, it's also important to just switch off the consistent news cycle, the consistent updates, the consistent social media. Take time away. That's also very important. But switch up in that, it may seem generic, but exercising a little bit of activity really helps. It goes a long way. Taking care of the sleep cycle is also very important, and just being able to seek out help as early enough is also quite important. And staying off of drugs and alcohol, it's really it's not a sustainable way to deal with the anxieties and the emotions that come with a situation such as a crisis like this. So I think that would be my advice to young people.
Okay, good to know. Any advice to young people about their health?
Yeah, I think this is also an invitation for us to be very mindful in what we're consuming in terms of also food, because we don't have a lot of access to fast foods right now. So really feeding our body nutrients, because we understand that if you feed your body good foods, it does play out into how you think and conceptualize things. It's also an invitation for us to start doing rituals, because rituals really put us in control and in charge of our lives, because they feed our spirit. And when our spirit is fed, we come to a place of contentment and a place of inner peace. So it is really a time, like everybody has said, it's a rebirthing process. Maybe you are about to go into something and sign up yourself for a lifetime commitment that you wouldn't be able to do anyway. So this is to reflect and to keep a gratitude journal. People can actually wake up with the things that they're grateful for. Go outside, even though you're restricted in moves, but just
Okay, we've lost Gogodina. Okay, thank you, Gogodina. We lost you there for a bit, but I think the gist of the message came across. Belinda, any last words to young people out there about their health?
Yes, well, I think we've all said it. Look for a friend or somebody you can talk to and about your feelings, your fears, your worries. I think that could help. and just try and get things that you'd normally like to do, try do those and just deal with these things as it goes day by day, one day at a time.
Thank you so much, Belinda. We are at the end of our questions, but I think we'll open up the session to questions from our participants. There's quite a few questions that we have to go through. Some have been answered already. Belinda had addressed the symptoms of depression, but there's a question that is directed to Dr. Charles. So in just a minute, Dr. Charles, can you sum up some of the symptoms of depression?
Okay. Some of the symptoms of depression are, first, the person will be feeling feeling of worthlessness that is not important. The person may not have appetite to eat food. Then the person will be antisocial. He will not want to associate with people. He might not want to go out to events. The person might dissociate himself from what he usually used to like. Maybe if it's someone that like playing football or someone that like watching films, he might dissociate himself from those things. And there's also lack of energy. The person will not be active again in communication. There is some level of decrease in the person's level of skills. The person might not be able to do what he used to do before. Then severe depression, of course, can lead to thought of suicide and other complex psychiatric problems.
Okay, thank you, Dr. Charles. And Alistair, if we respect lockdown, can we manage the pandemic?
So the issue of the lockdown is the thought behind it comes from what most people are calling flattening the curve. And what that basically means is that our health systems have a certain capacity. And if infections were to spike in the manner in which they are projected to spike, it would result in immediate overwhelming of our health systems. So when we have lockdowns or social distancing measures, what they're simply supposed to do is they're supposed to help flatten the curve in that this rapidness of the spread of COVID-19 will be slowed down, so to speak, and then that allows whoever contracts COVID-19 and has severe symptoms to access healthcare without an overburdened health system. So it doesn't necessarily stop COVID-19, but what it does is it reduces the potential deaths that we may experience, the potential severity of our health system, of the impact it has on our health system. But the long-lasting solution, as the discussion is actually on health system strengthening and also a vaccine coming up or a cure of sorts coming up. But that won't stop COVID-19. So I think that's how I can answer that question directly.
Yeah, thank you so much, Alistair. And Sanlisiwe, how can young people ensure mental health well-being in these times? And where can they connect to counselors? Gogo had mentioned that online option now. We've gone virtual with a lot of our sessions, but how can they ensure mental being during this time?
I think one of the most important things is that they should get, because getting infected, that's going to minimize the fear. So they should use like the websites that are providing accurate information about the virus. And I think we should, we all know platforms in our various countries where we can talk to people and seek help online, which I think is one of the most important platforms at the moment, because we can't move around and go to hospitals and clinics to see our therapists and psychologists. So I think they should visit the pages that we all have available online, and maybe they can talk to individuals who kind of listen without judging. And so basically everyone knows the platforms in their countries. So I think the young people know how to best like attend to their issues.
Okay, thank you so much. There's a lot. Then Gogo to know, there was a question that was asked earlier to Gogodinao, how do you think young Africans can view African healing work as valid and not just as something for older people? You had answered it, but do you mind answering it again so that everybody can benefit from the answer?
Yeah, I spoke earlier on. I hope I'm audible because you've been struggling to hear me. I spoke about spiritual health being incremental to our well-being because we understand that as the human system, we are also spiritual beings. And that does not because in spirit level, it doesn't matter how old you are, but it also helps us really be connected. It helps us be grounded. It also it helps us find meaning and purpose in life, because some of us experience mental illness because we are not finding fulfillment and meaning in the things that we are doing. So going through spiritual healing helps you find your own unique DNA code of why you are here at this time that you are in. Why were you born to experience COVID? What is the importance of your life? So it gives us an identity and a deeper meaning. So that's why it is important, and it's not for older people, or it doesn't have an age. And I think it's important for people to go through spiritual healing or stage because they don't get into things that 20 years later in their adult's life, they're feeling stuck. So you can have a clarity of purpose once you start going on spiritual healing journeys.
Thank you, Gogodinao. We have quite a lot of comments, all of them very positive about what we should do as young Africans. And there's one from Kande in Sierra Leone. How can we all find a way to take the mind of young people from stresses that are caused by COVID-19? I think Sanali Siwe had addressed it earlier to say, let us, as well as Belinda, to say, let's stay away from all the negative things that are happening on social media. Let us try to be as positive as we can during this time. And then there's one from Dunia. He says, we can work in our mental health by ourselves, and I hope this pandemic will end. I think we're all rooting and hoping this pandemic will end very soon. And some is just words of encouragement and what other African countries have done during this time. And then there's one from Helena. It says, as young people in the continent, are we prepared to fight the pandemic? If so, what measures can we put to ensure that the pandemic does not leave scars in our minds that will last forever? Any of the panelists would like to attempt to that question? How can we, as young people, what are we doing, and how can we make sure that the pandemic does not leave scars in our minds? Dr. Charles, would you like to have a jab at it?
Okay, what's the question again? I did not get to.
The question is, as young people in the continent, are we prepared to fight the pandemic? If so, what measures can we put in place to ensure that the pandemic does not leave scars that will last forever?
Okay, well, young people across countries in the continent have already been taking several measures to sustain other people in their communities in the course of this pandemic, from innovative ideas, innovative projects on delivering food to people at their doorstep, to delivering health services, power supply, and every other thing. So I think other young people in the continent should also try to innovate and create out new ideas on how to curtail the pandemic and make sure that people live at their fullest in the course of the lockdown. The young people should also be involved in campaigning on the preventive measures of COVID-19 to decrease the spread and rate of prevalence in the different countries. So in summary, I think young people should be proactive. They should innovate on different ways of acquiring new skills to enhance their business. Then they should be proactive in helping the government and other organizations to fight the pandemic through creation of health awareness preventive campaign against COVID-19.
Okay, thank you so much, Dr. Charles. And Alistair, I think you've started a hashtag, switch off and switch up. So I think everybody's taking that on. We should really switch off and just switch up and try to adjust as it's going and focus on the positive outcomes and not on the negative. That's Festus Daniel. I think he's going towards what Sanlisio has said, to say, let's focus on the positives. We're having more recoveries than deaths. So that's something that we should really focus on instead of going the other way. And then there's Tebelelo Agnes Sissingi, who's saying, I think in as much as we have to comply with the WHO regulations and laws about COVID-19, we have to bear in mind that we are worthy, we are capable, we are in control, and lastly, we matter to others. And I think this is a beautiful way to sum up this session, to say, despite everything that is going on, we are worthy, we are capable, and we're in control of the situation. And I think as we're just coming to a closing, I'd like to thank
Can I say something, Putswani, very quickly?
Yes, you may. Go
Yes,
ahead.
I just want to say that we know Africans are very resilient. So this is not the first pandemic. Globally, it has hit, because we've been hit by a lot of pandemics. We've come from colonization, we've come from slavery, we've come from HIV and AIDS, because it hit the continent hard. So in our nature, we are a continent of resilience. And we understand that this too shall pass, because nothing stays the same forever. And it's to also go into our history and see how have we managed to overcome, because this is an invitation for us to also look at the things that our ancestors have done to overcome such disturbances or turbulences like COVID-19. So we need to start building positivities around our psyche and our psychology. And I like what Tibelo said, we cannot just look at the WHO, because it's time to also look within the continent and say, what are the resources that we have? What have our people done before? Because we understand that this pandemic is a chronic influenza. We have experienced it before. We might have our ways of healing it. So what is it that we can do as Africans? It's an opportunity for us to shine. Africa, our time is now. So let's not always look outside for wisdom and solutions. Can we look and start deeply interrogating what have we done before and what does it mean for us now?
We are in control. We got this. And I think we were as we're summing up, we're having a message of positivity. We're optimistic. We know that this is a time for us to shine. And I have to congratulate everybody on the panel today, because despite everything that is going on, we're able to see all the opportunities that can come out of this COVID-19 situation, opportunities that can help us actually become a better Africa than what people think we are. We've gone through the issues of fourth industrial revolution. It literally hit us in the face, and we have to adapt it and make sure that it works for all of us. Telemedicine for us health professionals, it's time we really interrogated that and started using it more. And just interrogating our mental health and making sure that it's up to par, as well as our health systems. We are always complaining about them, but what can we do? What have we learned from COVID-19 to say, okay, moving forward, this is where we're going to go? And as we close the session, I'd really like to say thank you so much to all the panelists. You've been amazing. You've brought across issues that I think have left people very comforted, and they know that they're going to go forward with this COVID with a positive mindset. There's a lot of questions that are coming through, and I think Breaking Down Borders will address some of them. But to all the panelists, it's all words of thank you so much for the panel, and everybody seems to have enjoyed listening to you like I had promised them. So thank you so much. We are going to be closing off our meeting now. Thank you so much, guys.
Thank you.
Thank you.
Thank you, Charles.
Thank you so much.
Thank you, Sanlisiwe.
So much. This is beautiful. Thanks.
Thank you, Sanlisiwe.
Thank you so much.
Thank you, Nicolette.
Thank you.
You're welcome.
Thank you, Alistair. We can all leave, Charles, Alistair,
All right.
Nicolette. Thank you, Haja.
Thank you so much. Thank you for this initiative. And just one word before we leave, I hope that we are going to commit to commit, and this will not end here. This is the beginning, and I believe that we have a promising path all together. Thank you so much again for the initiative.
Thank you, Haja.
Mm-hmm. Can you hear me? And to everyone who has been hanging on and taking part in this summit, I see people are still sending questions in and comments. A great thank you to everyone who has been part of the Breaking Down Borders Virtual Summit 2020, as we took a stand as young people to give response and give voice to young people across the continent in coming up with ideas and sharing experiences around what our realities are as we live through the reality of the COVID-19 crisis. My name is Motlatsi Mutsiwile, and I am a member of the Breaking Down Borders Africa Initiative planning team that is responsible, of course, for the bringing together of this summit as it did. One of the things that has been very important for us as a platform from inception has been to not only be a platform where we talk about our issues and our problems as young people, our challenges, but also to give voice to the ideas that the young people have around the realities that they're going through, and to give somewhat of a platform to voice out what ideas young people have around those challenges that they may be experiencing in the different parts of the continent and the diaspora. And this has been one of those as well. We realized that, having made an announcement in 2019 that this biannual summit, therefore meaning our next sitting from 2019 will be in 2021, we realized that there was an important need for us as young people to get together and speak about how we are living through COVID-19 as a crisis, but also as a reality in our homes, in our workplace, the different subject matter that has been addressed throughout the week. My role in this at this particular point is to just give a great thank who has been part of this initiative. And to kind of give a sense of what to do next. Where do we go from here? It is always important that to us as a platform to not just be a talk shop, but to be a platform for young people to take action. That's what we are about. And that's why even to this year, our theme was around giving action. It was about collectivism. It was about collective youth activism, but it was also about how do we realize activism as young people in these times, as we are sitting in our homes in the different parts of the continent where we are locked down, or where we are and unable to, to move and to, engage, travel, and move to other parts where we can engage in work that we'd like to be engaged in. So how do we then take action and become active in coming up with solutions to the different challenges and issues that young people are facing at this particular point? A quick rundown of the conversations that went past this week. From Monday, we started off with a very, very important discussion around youth activism, where we had a panel of young people in different organizations and parts of the continent who spoke about the importance of young people to take a stand, to take their place within the crisis and coming up with solutions. So not to sit on the sidelines and complain, not to sit on the sidelines and actually outline what the challenges are, but to be part of the circle of solutions, to be solutions engineers that then say, these are the challenges that young people are facing, these are the challenges that the continent is facing, and this is how those challenges can be overcome. Thank you so much to the participants in that particular discussion, from the panelists to the facilitator. A great thank you from the team. Following that, on Tuesday, we spoke about the impact of COVID-19 on the livelihoods of young people, both as employees and as employers. So entrepreneurs and young people who are employed by different organizations engage in a conversation around what the actual impact on that was on their lives, and how to then go about surviving this challenge, this crisis that has a direct impact on our, our capability to earn a living and create life for ourselves and earn whatever we could be earning from engaging in economic work. And from that conversation, it was important for young people to engage and voice out their frustrations around the economic conditions that have been impacted by COVID-19. And thank you to the participants in that particular conversation from both the participant side, rather the panelist side, and the facilitator in that conversation. A big thank you as well to our all-women panel that took part in a conversation on Wednesday that spoke to the impact of COVID-19 and women and girls. And in that particular conversation, one of my favorites personally, that ultimately brought out the fact that women remain on the front lines in our economies, but just as equally remain as disenfranchised from earning and from benefiting greatly from this economy. And in this time, you see an exacerbation of gender-based violence issues, violations in sexual violence, and the breaking down of services in sexual and reproductive health and other health services, and as well as other socioeconomic rights being impacted by this crisis. A great thank you to the participants in that conversation, our panelists and our facilitator. And yesterday, we had a broad conversation on the impact of COVID-19 on human rights. This was a very, very important conversation to have as we looked at how can young people then become active in responding to the human rights violations. Broad conversation that touched on issues of physical violations from the authorities and how civil society and young people can engage the authorities in coming up with solutions around avoiding human rights violations at this particular time. A great conversation that was. Thank you again to our participants in that particular panel discussion, both the facilitator and the panelists in that conversation. And of course, we are emerging from a very, very, very important conversation that nicely sums up what this week has been all about. We've all spoken about how this particular crisis has impacted us in various ways, from our ability to earn a living, from our ability to move and go wherever we need to go, for our ability to engage in change work, and ultimately the impact of that is an effect on our mental health and our overall wellness. And this particular conversation that we are emerging from that was had today was about that particular challenge. And thank you to everyone who took part in that conversation. Our biggest panel in this week, of course, talking about the importance of addressing not only our physical wellness, but also our emotional and mental health rather. So a great thank you to our participants, panelists, and our facilitator in that conversation. A big thank you goes to our partner, the Human Rights Commission of South Africa, who are a principal partner in executing this particular summit and sitting, responding to that and speaking to the importance of engaging in conversations in as much as we are unable to move, as we've always had the ability to host a physical summit, a physical gathering, but still being able to execute a gathering of young people from across the continent who could engage in conversations that matter, conversations that impact their lives directly, and of course, engaging young people in solutions that they can effect in their different spaces. A great thank you as well goes out to our media partners who ensured that word was out in every part of the world, every part of the continent, to ensure that you who is watching, who has been watching from Monday right through to today, was part of this summit. So great thank you to our media partners. Another big thank you goes to our reference group who advised us in various conversations as we planned this sitting. A great thank you goes out to them. A big thank you to our network of young people from across the world who spread word out as they received information, who responded to the call to action to be part of our various panel discussions, to give us insight in terms of what young people wanted to be speaking about, what young people wanted to be engaging on at this particular time. A great thank you goes out to those people as well who are part of our network and our reference group. As always, when I give these messages or these particular speeches, short speeches as they're meant to be, I want to give a great thank you to our core planning team, right through from our founder, our founding team, made up of Mr. Paul Majaji and Tabising Majaji, who lead this team and run the program awesomely. So we come up with the different conversations that we need to come up with and then spread word out. Thank you to our program coordinator, Ms. Lohato Modongo from Botswana, who has been part of this team since inception, just as well. A great thank you to her. Great thank you to our communications team made up of Kabelo Daunyane, Ms. Siba Sismani, and Tebuho, who run our social media and ensure that our word is out there at all times. Posters are out there at all times. Communication is always running as we run this particular platform. And lastly, and very, very importantly, to everyone who took some time out, whether it was an hour, 15 minutes, 90 minutes, as it may have been in certain sessions, to tune in, to take time out of your busy schedules throughout this week, to tune in from Monday right through to today. A great thank you to you who supports the work that we do, engages in the work that we do, and commits to continue doing so as we ensure that our work reaches young people across the continent and in the diaspora. From Breaking Down Borders Africa, we thank you. Thank you for your support and your continued commitment to the work that we do and to the commitment that you have to the work that you do, because it is the work that you do wherever you are ensures that we can do the work that we do. If young people are not active in driving change, there will be no need for us to then talk about the importance of breaking down both the physical and mental borders that separate us as young people who are intent on ensuring that we act collectively. To everyone who's got questions, our social media handles are at BDB_Africa on Twitter and Instagram, and we are Breaking Down Borders Africa Youth Summit on Facebook. Reach out to us. You can also email us on info@breakingdownbordersafrica.co.za and reach out to us with your questions. I see a lot of people asking how can they be part of the movement, how can they take part in everything that we do, how can they contribute to everything that we are part of. Please reach out to us, like I said, at BDB_Africa, BDB_Africa on Twitter and Instagram, and Breaking Down Borders Africa Youth Summit, that is on Facebook, and info@breakingdownbordersafrica.com. Apologies, it's info@breakingdownbordersafrica.com. Reach out to us and we will respond and we will engage you and bring you on board in the work that we do. Once again, my name is Mutladzi Mutsiwile. A great thank you to all of you, and let's continue keeping a positive outlook and driving change and being innovative in ensuring that we make it to the other side of this crisis. Thank you so much.